Hi everyone, my name is Patrick Amasinde. I'm a caregiver at Aga Khan University Hospital. I deal with ostomates and let's break the poo taboo. I hope you help me do this. For start, let's talk about cancer and its rehabilitation. We have growing challenge in our nation and we are realizing many cancer types of cancer in many patients. And we want to talk specifically about one type of cancer, that's a colorectal or cancers of the gut. Now, we know the function of the gut. We know when we eat, we expect to pass some poo. Now, in African context, talking about poo is usually taken as a taboo, and most people often shy away from this topic. Nonetheless, cancer patients with the colorectal cancer type have no choice. One thing they go through is surgery as a model of treatment, and then chemotherapy and radiotherapy. Of specific, let's talk about surgery. When you go through various types of surgeries, especially for the low-lying cancers of the rectum or of the colon, most of these clients end up having colostomy, ileostomy, or urostomy, depending on what area is affected. And so this, for some reason, depending on the type of cancer we're talking about here and how advanced it is, some of these clients end up having colostomy or ileostomy or urostomy for life. Some have it as early in their life, some find this late in their life. Nonetheless, all ages suffer the same fate. They have to live with the bag. This is just one type of a colostomy bag, and this is their day-to-day business, carrying this bag every day and making sure that this special pouch then collects their poo upon which they use to drain in the loo. So for the colostomy, which is a big burden of rehabilitation of the colorectal cancers, they have to live with this every day. There are many types of surgeries that are involved, like I previously mentioned. Nonetheless, of critical sense is how do you live as a man, as a woman, as a child, as a friend, as a lover with a bag for a lifetime. When you talk about the taboo involved, we know a one-day-old child, usually they sneer at the smell of the poo. How about a husband? How about a wife? How about our children? How about that neighbor? Take a moment and imagine what they go through when they carry the bag through our matatus, at church, social institutions, at work, and this has never limited them to live their lives. We are here to break this taboo. We are here to make a voice that cancer is here with us, and much more, rehabilitation of the cancer patients is of great importance to us. Please help me. Let's break this taboo. As I care for these patients every day, one major thing that I do and interact with every day, day in, day out in the week, is patients who have stomas. You're wondering what's a stoma? A stoma is a protrusion or a surgical creation from a section of your gut to help you remove your poo. And you're wondering, where is the poo? Normally we'll go in the loo and do our business in the loo, but for this type of patients, mostly colorectal cancer patients, then have to wear a pouch, a special pouch that they use to collect their poo every day. My business is to make sure that this bag is available for all. My business is to ensure that patient in Wajir, in Migori, in Homa Bay, in Nakuru, across our nation can access this pouch. What we have in the market is just a paper, and this pouch, as it looks, you can guess how much it costs. On the minimum side is 500 Kenyan shillings. On average, in the Kenyan shops, on the Kenyan distributors, you'll get to even a maximum of 1,000. Now, take a look with me. This patient needs this at least 2 bags in every 4 days. That means in 1 week, a patient needs three bags of this type to facilitate their lifetime. In terms of cost, that means a minimum of 1,500 Kenya shillings per week just for this special pouch. Do that for a lifetime. How much will it cost?